All right, let's break down heart murmurs right now. Look, it really all comes down to just two things: timing and location.
First question, is it happening between S1 and S2? That's systolic.
And for that, you need to think MRAS, mitral regurgitation, aortic stenosis.
Okay, is it after S2? Then it's diastolic. And for that, think MSAR, mitral stenosis or aortic regurgitation. And here's the key takeaway. Diastolic murmurs are always pathologic. You absolutely must get an echo on that patient.
What about systolic murmurs? Well, a grade 1 is super faint, but a grade 4, that's when you can actually feel a palpable thrill. Then you've got grades 5 and 6. Those are audible with a stethoscope just barely touching the chest, or sometimes even completely off it. So know the timing, check for a thrill, save the valve. Let's move.
Okay, before we go any deeper, we have to cover the mandatory medical disclaimer.
This content is for educational purposes for international boards only. It is not medical advice. Always consult official guidelines and a specialist physician for clinical decisions.
All right, now let's get into our deep dive. You know, a really common point of confusion for students is that moment of panic when they first hear that whoosh sound. So Sarah, what is the first, simplest step you should take?
So let's start here. Why is timing the single most critical branch of our decision tree?
Well, Dr. Collins, it's because timing immediately separates the physiological from the pathological. It's that simple. You see, systolic murmurs, they happen during the heart squeeze, and they can be innocent. Think of a classic Stills murmur in a child. But diastolic murmurs, they happen when the heart is filling, and there is just no such thing as an innocent diastolic murmur. So if you hear that, the next step is always an echocardiogram, no question. Exactly. Diastolic equals echo. It's a non-negotiable. Now let's talk about the grading scale. It's funny, everyone memorizes the numbers, 1 through 6, but they forget the real clinical marker. That marker is grade 4, and we call it the thrill threshold. Right, that would be the thrill. So a grade 3 murmur is loud, sure, but you can't feel any vibration. The second you place your hand on the chest and feel that vibration, that classic purring cat sensation, it's officially a grade 4. From there, grade 5 is heard with just the edge of the stethoscope, and grade 6 is so loud it's audible without the stethoscope even touching the skin. And for anyone watching, for more detail on this, you should absolutely check out the 2021 ESC guidelines we've linked below. They actually use these grades to help guide surgical decisions. Okay, Sarah, let's lock in the 4 giants of murmurs. Okay, so for systole, we have mitral regurgitation, which you'll hear at the apex, and aortic stenosis at the right base. For diastole, it's mitral stenosis and aortic regurgitation. We use the mnemonics MRAS and MSAR to keep them straight. Perfect. And let's not forget the sound and radiation. Systolic is usually described as a blow or a crescendo, while diastolic is more of a rumble or decrescendo. And crucially, aortic stenosis radiates up to the carotids, and mitral regurgitation radiates out to the axilla.
All right, Sarah, it's time. Let's lock the murmur tree.
Systolic is the push, S1, S2. Diastolic is the fill, S2 to S1. Diastolic, always echo. Grade 4, feel the thrill.
MRS are the S systolic.
MSR are the D diastolic.
Check the links, master the murmur. Okay, algorithm locked. You know, that chant really does help cement the entire framework in your mind. And that brings us to our question of the day. Have you ever actually felt or heard a grade 6 murmur? I mean, they're so loud you can sometimes hear them without even using a stethoscope. We want to hear from you. Tell us about your loudest murmur stories down in the comments. Excellent work. So we've identified the whoosh, we know how to classify it, but what if that whoosh changes when the patient squats? Make sure you subscribe and click that notification bell because in our next explainer, we are tackling dynamic auscultation.